Uh, Good afternoon, everyone. I'm Dr. Jueria Sultana, final year PG, doing MD Microbiology in Kakatiya Medical College. Today, I'll be presenting my topic of the paper titled to identify the relationship and distribution of CD4 count among TB positive individuals in HIV and AIDS patients. Coming to the introduction, TB is an opportunistic infection. Opportunistic infections, by definitions, are the infections that occur more often or more severe in people with weakened immune systems than in people with healthy immune systems. HIV infection is a disease which weakens the immune system, increasing the risk of TB in people with HIV. TB and HIV or AIDS constitute the main burden of infectious disease in resource-limited countries. In the individual host, the two pathogens, that is Mycobacterium TB and human immunodeficiency virus, they both potentiate one another, accelerating the deterioration of immunological functions. In high burden settings, HIV co-infection is the most important risk factor for developing active TB, which increases the susceptibility to primary infection or reinfection, and also the risk of TB reactivation for patients with latent TB. So the ones who are having previous TB will have a latent TB if they have HIV co-infection, or they will have a new HIV, or if they are having a new TB infection, it will be of a greater intensity. MTB infection also has a negative impact on the immune response to HIV, accelerating the progression of HIV infection to AIDS. So MTB is also deteriorating the HIV infection, and HIV is also deteriorating the TB infection. This is seen in lower CD4 counts. The opportunistic infections are more when the CD4 counts are lower. This is why HIV is especially important when, to monitor when the CD4 count is low. Different illnesses become more likely at different CD4 counts. Serious and fatal illnesses increase when the CD4 count drops to under 200 cells per mmQ. The risk of TB is higher in HIV positive people. This can occur at any CD4 count. So this study aims to identify what is the relationship and what is the distribution at which CD4 count does TB infection occurs in HIV and AIDS patients. Coming to the materials and methods, this study is a prospective study. It was done over a period of 7 months, starting from January 2021 to July 2021. So the patients who are HIV positive, which were confirmed through immunochromatographic or ELISA test, they were tested for TB infection. That is via sputum examination or CBNAT or by radiological examination. And if they are found positive, their CD4 count at the time of TB infection was measured and the results were analyzed. Coming to the results, due to COVID, we did not find a lot of patients in that 7 months time, but we were able to find 25 patients with HIV and TB co-infection in that period. And among them, 21 were males, that is 84% were males, and 16%, that is 4 were females. As you can see in the graph, the mean age at which TB infection is seen in males is 40% occurs in 31 to 40 years of age, that is the middle age, followed by 24% occurring in 21 to 30 years of age, followed by 16% at 41 to 50 years, followed by 16% the same at 41 to 50 and 51 to 60, and only 4% occurring in 10 to 20 year olds. The highest incidence of TB infection in HIV male patients is seen at CD4 count of less than 100. 38% people got affected when the CD4 count was less than 100. 19% got affected when it was less than 200 and 300, and only few and equal number got affected when the CD4 count was more than 400. That is around 500 or so, and only 4.57% was affected when it was between 300 to 400. Oh, this is the CD4 count and the age wise distribution according to their percentages. This is seen in male patients. Now coming to the female patients, the mean age, since there were only 4 female patients, the mean age at which TB was seen was 75% was seen in 21 to 30 years of age, and only 25% was seen in 10 to 20 years of age. Their CD4 count was the maximum number of TB infection was seen at CD4 count, that is 50%, was seen at less than 300 CD4 count, and followed by 25% each below 100 and above 400. Now this is the table age wise according to the CD4 count in female patients. So coming to the conclusion, in this study, we conclude that TB infection incidence occurs more commonly in HIV positive patients at mean age of 31 to 40 years and at CD4 count of less than 100, that is seen in males, and at a mean age of 21 to 30 years and at a CD4 count of less than 300, this is seen in females. So therefore, education and counseling is required for high-risk groups to prevent the occurrence of co-infection for better prognosis and life expectancy. So these are the references. Thank you.